most potent will pretty much end up in our community almost every time. Whatever affects the larger, greater community, it affects our community three times as much as the flu, whatever it is. So we need to focus on. So this morning, thank you all for being here. We're going to ask that Brother D'Angelo Taylor with the Men's Health Network, he's going to have opening remarks, and I'll come back and to the prayer, and we will begin with it. Good morning, good morning. How's everybody doing? Feel like I need to stand up. Good morning to everybody. Welcome for being here today. Hope that you guys just enjoy yourselves. Conversation. I think that we're going to just really talk about the things that are affecting us, affecting our community, better with ourselves. So, of course, if we don't take care of ourselves, we know that need us, move forward, and we're not here to help them. That hurts the entire family. So we just want to spend a day, spend some time talking about the things that really matter. So before I go into that and talk about those things, I want to take a moment to talk about the Men's Health Network and what it is, right? Who the organization is, what the organization stands for. Again, my name is Miangelo Taylor. I am the event coordinator for today's event for the Men's Health Network. And how many of you all already knew that? I got two, I got three, I got four. Good. So the entire month of June is dedicated to men's health. And so we want to make sure that as we move forward, that we celebrate. You know, this when the first women in purple, we want to start doing that as well for our month to show that it's important for us to take care of our health, right? So at the Men's Health Network, we need to sit down now. We are dedicated to significantly improving the health, longevity, and quality of life for men and their families, men, boys, and their families. The Men's Health Network was founded in 1992 in the headquarters in Washington, D.C. It is a premier resource for the specific health needs related to people. Did you all know that there was a network set up helping our um, things in place to help me understand? I didn't before I started working with the organization. I had no clue. You know how sometimes it's me and you believe nobody else really care about it. We just out here on our own, just trying to. But this organization is doing and it is a champion for us. And today we're various shades of blue to support the men in our diverse community. So for me, I got on a blue jacket and a blue watch. Right? Because it's important that we celebrate and acknowledge the community. All these battles, some of these won, some of lost, some of these battles. But we want to make sure we help the next generation understand. And so I am pleased to introduce to you all today, for those that don't know, Dr. Baker of the Thank you. Good morning again. Thank you all for being here, and let me just uh, thank you all for allowing us to host this fellowship this morning. Thank God for all who are in attendance, and we are we hate the weather is inclement in certain sides of town, but we thank God for those of you who come. Welcome to the United States Church. If there is anything you need while you're here, please let us know. We want to make sure that you prosperous in that benefits you, mind, body, and spirit. Thank God for all of the presenters who gathered today. We look forward to the blessing of the Lord. Thank God for our sister Christina McKinney and all that she does in our community. She's been working in our community tirelessly for years in many different capacities. And I don't know how she got tied up with the Men's Health Network. But she's been here with us with all of us. And she's done a lot in the community, and we are grateful to her for the efforts that she's been for us since probably 30 years. she's been working, and there are there's some legends in community health and community outreach. First Payne's been with the American Cancer Society for 40 years. First been with the American Cancer Society for 40 years. First Payne. Uh, Carla Baker has done, she's been every, and we thank the Lord for what she's done for our community. These are people who have been working in our community tirelessly for years, trying to get the resources out in our community. The farther we can put resources upstream in the community, the better off all of us. I thank God for your support and you for this help here. And we invite you to visit all the venues who are out front and get your bag and take whatever you want to take. But take your resources back to your churches, to your village, to your home. Thank God for pastors who are sharing with us. Thank God for Pastor Motley. Thank God for Pastor Kate sharing with us. Thank you, Lord, for any other pastors who we thank the Lord for each and every one. Gracious loving God, it's again, God, that we have assembled ourselves together, Lord God, to do what you've called us to do, God. God, for it is your desire that we prosper and be in health even as our souls prosper. And God, we thank you for those who are laborers, God, in this effort. And in every effort, God, that you have ordained, God, for your people to prosper, God, for your people to be healthy, God, for your people, God, to be able to be symbols of what you would have us to be in this world and in this life. Lord God, we just pray now in the name of Jesus that this conference, God, would be a blessing, God. God, that it would demonstrate your love, your guidance, your protection that you have for your people. God, we thank you now for each and every presenter. We thank you, God, for each and every planning team, God. For every person, God, who came today, we pray that you prosper their ministry, God. Work with them, God. Prosper the work of their hands, God, that they might be a blessing to your people and that they might prosper your kingdom. God, we thank you, God. We love you. We praise you in Christ. Amen. Thank you so much for today. Thank you. So what I want to briefly do is because some of the vendors or our planning community here, you know, I can say thank you again. I'll just recognize if you call names. I'll just recognize it. That's okay. Of course, the Lions Church, thank the Alzheimer's Association, the American Cancer Society, Families Matter, the Fraser Community Representative, Methodist Obama Healthcare, Shelby County Health Department, the Urban Health Education Support Service, and WellPoint. You all for the make it happen. And so what we want to do now is we talk about your so do you have the name that you were looking at? Mr. Bridges, what we have for you, Mr. Bridges, is listen, the way this rain is falling these days, you never have too much of a sturdy umbrella. So thank you so much for the diligence and getting set up for this. We'll be so much for today. Let me thank you for you, your service, your can't have somebody pick it up. If you call your name and you're not here, you go to the next person. But as you can see, can you hold on to part of the way? So that's all we have to do is make sure we hear all of the community and make sure we hear. Philadelphia. So, thank you. So with that being said, you all, now we want to start. We're going to start with our first panel, and this panel is titled Ask the Doctor. But what I want to do is make sure that I introduce those that are here on our panel. And before I introduce them, can we just give them a round of applause, please? So each speaker will have 10 minutes, and then we'll do an open discussion in this process, right? So I will start today by introducing our first panelist, is Dr. Leonard Vidal. Am I sorry, they do. He is professor of medicine and the director of the Inflammatory Bowel Disease Center at the University of Tennessee College of Medicine. On July 1st, 2023, he became a professor at the College of Medicine. Dr. Ledoux will share important information about colorectal health and cancer. But before I go on to say in our brief conversation, I'm really concerned. You didn't say this to me, but he is um, by, he is by way of London. He is a graduate of Oxford University and Stanford University. Y'all, please give that a round of applause. I told him when he came in, sir, that is absolutely impressive. So I just wanted to say that, and I wanted to give you an opportunity to take the floor or take the mic and share your information, sir. Well, thank you guys for the it says it's kind of nice to see people who really like you. I see everybody, but it's nice. And yeah, oh, the thing I've realized is that a lot of whatever disease you think about, you find that men, especially men of color, have all the worst diseases or have the worst, partly because a lot of us don't have access to medical care easily, either because we don't have the right insurance, or again, we don't have the right doctors, or again, we don't trust the health system because of some historical things that have happened. Right now, I hope that by doing something like this, you guys will start trusting some of us and start trying to see my colleagues whatever color they are. So you always, you don't go to dinner with them, use them, right, and get your health sorted out. So I'm a gastroenterologist, so I deal with everything that involves from your mouth all the way down to your intestine. But today I'm going to talk about colon cancer because it's one of the commonest cancers in this country. Uh, 1 in 10 cancer deaths in this country is from colon cancer. Every year, 140,000 people are diagnosed with colon cancer, of which 60,000 will die. As I talk now, there are roughly about 2,000 surviving colon cancer people in the country. And unlike other cancer things, this is one of the cancers that is totally preventable. Right? The commonest cancer in men is prostate cancer. The commonest cancer in women is breast cancer. And in both of them, the second is lung cancer. Then for men, it becomes colon cancer. Women, it becomes breast cancer. But for prostate, when they do your blood test and they find something, by that time you have the cancer already. For breast, when they do your mammography and they find something, by that time you have the cancer already. Colon cancer is one of the few cancers that you can prevent, and so you don't get by doing something. Right. So, what kind of people or who gets colon cancer? Like I said, it's a very common disease, and as one of the commonest factors of colon cancer is just growing up. Right. It's more common in people who it's more common in people who are very sedentary, don't do a lot of physical activity. It's more common in people who are overweight. It's more common in people who eat a lot of processed food. So I always tell people when you go to Kroger, don't go into the middle, shop at the edges. That is where all the fresh foods are. If you go into the middle, that's where all the canned processed foods, to avoid those things. People who eat too much red meat, especially if you cook it at very high temperatures and it blackens, the black parts, those things are the people who, if you have diabetes, high incidence of getting colon cancer. If you have any relative or any family member who's had colon cancer before, who's had even polyps, you are at high incidence of getting colon cancer. So since we know this, what do we do to avoid colon cancer? You have to see your doctor to do what we call a colonoscopy. Many people don't like it because you're going to see somebody to stick something up your backside, right? Most people don't like it, but it's life saving. The biggest thing to understand is that we found out, like I said, for most cancers, it's more common in black people and people of color. So until recently, for black people, we started doing our colonoscopies at age 45. But then we found out that it is not, it doesn't, it's made by race. So now in the whole country, whether you're green, blue, whatever you are, we start scoping everybody, do a colonoscopy at the age of 45. The idea of bringing it to 45 is that is when you start developing polyps. Polyps are little growths that we see in your colon that if they stay for a long time, they turn into cancer. So if we see you early and we get rid of it, then you don't develop cancer. And even if we see you and you have the early stage of cancer, we can scoop it out and then that's it. If you wait till it's too late to have colon cancer, they can give you some chemotherapy to just kill the thing down so it's important that if you have anything, you go and see your doctor. Sometimes there are no symptoms. There are no symptoms. You won't feel anything until it's too late. So if you are 45, that's good enough. That is a symptom for me. The fact that you are 45, you should go and see your doctor to have a colonoscopy done, right? And colonoscopy is a big deal, right? You have to drink a jug of something, which is the annoying part, right? It makes you go to the bathroom a lot. But when you come in, they sedate you, you are out. And then we stick the thing up your backside, we see everything on it. And if we see the polyp, we get rid of it. If you don't have a polyp, then you're free for 10 years because the polyp, from the polyp stage to the cancer stage, it takes about 10 years. So if we see any polyp, depending on how many polyps we see, or how big the size, we think bacteria. You do it once in a time, but the important thing is make sure you are preventing it. If you wait till you see some of the symptoms, usually you go to the bathroom, you see blood, or you start getting a lot of body pain. Those are the symptoms that will suggest that you are getting colon cancer. But you don't have to wait for that. If you wait for that, sometimes it's too late. So if you have any of these symptoms, nausea, vomiting, anything, blood in your stool, weight loss that you can't control, whatever your age, right? Because those are the symptoms of colon cancer that sometimes if you're not it goes down, you get your bowel habits suddenly change. You're moving your bowels once a day, twice, and suddenly you move your bowels for 3 days. So it started slowly, something is blocking. So that is those things you have to go and see your colonoscopy is very easy. You can't we sedate you and then you're done, right? So it's very, very important that you go. And like I said, eating well through health, keeping yourself healthy. Try to walk around. You don't have to do anything. Just walking up and down is fine. My mom had diabetes. What we did was we took away all the chairs in her place and put her a television at eye level. So she walked up and down. The only bad thing was that when we went to visit, we wanted to leave the church. And she said, no, you two stand and go up and down. So any physical activity, you try to shed a little bit of weight. And try to shed a little bit of weight if you can. If you have diabetes, make sure it is well controlled because diabetes is a very bad disease in itself and it predisposes you to getting many other things. Smoking is another risk factor for getting it. So if you smoke, I haven't seen anybody who has been able to tell me a benefit of smoking unless you have shares in the company that makes them. There is no benefit to smoking. Zero. Too much alcohol. Remember, I put too much in something. I didn't say you have a drink now and again, but too much alcohol, generally speaking, for health, too much of everything is bad. You can indulge in this. And smoking, there's no too much or too little. Zero smoking, you are doing yourself good favor. So I'll stop here and take any questions from anybody. I can go on forever, but trust me, but I think at 10 minutes, I want people to get a chance to ask questions.
Yeah, so you mentioned the test I just need to take the prostate. So you said the backside, so I'm gonna pick up the backside. But do they have one that to stay in time that's better, like the blood test? And if that's the case, what's the difference? And then the other question I have is, what's the ideal number for your prostate?
The everybody has seen commercial on television about Cologuard, right? Where you take a little bit of your stool sample of your test. And what that is trying to do is trying to see if they see something that was suggested. The bad thing about it is that they are false positives. It's like going to a football field, right? And you go to the end zone, only the corner you take a little bit of stool. There's a whole big left. So it might be negative and it's not really negative. So all those, if you want to do a real thing, so if you do the Cologuard and it's positive, you come to the gastroenterologist and do a colonoscopy. The advantage of the colonoscopy is when they do it, you can get it at the colon. Right? There's recently been another blood test that will also tell you that you have colon cancer, although those gastroenterologists is not that the FDA has approved it. But I still think it's colonoscopy because if you do your colonoscopy for one stage test, if you do the blood test or the Cologuard test, you can do a two-stage. If it's positive, you have to come in and do my miss. Some people might miss it because it's still because so I did my Cologuard and I did my Cologuard and in the next day, you have to and the ideal number for
Thank you. You also
it's
said,
a PS, it's called a PSA.
you also said that the college student, and so it takes 10 years. So even regardless what age that you're at, so they tell you to come back in 10 years at any age. So you 55, come back.
Yeah. Because if you are 55 and I do your colon is normal.
Mm-hmm.
You don't have a colon. So if you develop a polyp at 51, you have 9 years before you find anything bad. And by that time, you'll catch you and take the polyp out again. If you come and see me and you have a very big polyp, I'll always send it to the pathologist. If the pathologist comes and tells me that this is precancerous, near cancerous, I might decrease your time to 5 years. Or I see if you have 10 polyps, I'll bring you back to 2 years. Right. So it depends on what I find at the index colonoscopy. I'll give you a time to come back.
Okay. Now let me go back to my first question. Maybe I didn't ask you, but when I guess it's prostate when you're doing your prostate, some doctors still use their finger, right?
Every doctor should use the
So my doctor said if you got a longer finger, it's better.
If you have a sensitive finger, it's better.
Oh,
If you have a long finger,
well, he said his ladies' fingers are shorter, but men. Okay.
you just need because as the prostate, as soon as you go into the rectum, right, you don't have nobody has to go very far. If somebody is going very far to get to your prostate, then there's something wrong.
I need to change doctor.
Yes.
Okay.
Because as soon as you enter there, you should see it. You can just feel it. You can just feel it. So nobody can put your finger in your body. Usually, we don't have any large prostate. If you can feel it. Because if you can feel it, I've seen it. I've seen red prostate. You can always feel it. Just feel your, once you get to just feel
So that's better than a blood test.
for, for, for prostate cancer, no. All that tells you is you have to stick your finger in your body. You have a large prostate. But a large prostate does not always mean you have cancer. All right. Some people will have a large prostate, some they don't have a prostate. It just doesn't mean that you have cancer. Those are actually many one of the problems we tend to deal with large prostate. And some of the problems you go to pee and you have to keep pushing before the first come. And then when it finishes coming, you keep shaking because it's dribbling still. Right? Maybe cancer, sometimes and it's not smooth, it's rough. That will tell you it's 75. At 75, we stop screwing. All these things are screwing. But if you're 76, the reason why we stop by 75, this happens in the whole. You won't have that. You won't be to do it. So that's the age factor. Easier. Yeah, yes. Colonoscopy, yeah. That's 10 years. Mhm. That's the right thing. That means that they did not see it before. So coming back in 10 years. And a lot of people don't like you. I think that's up their backside. I'll tell you a story about myself. Because I'm a gastroenterologist, almost everybody who came to my clinic is in the upper backside. And so I went to see the doctor, right? And like he was saying that he had a fat thing, right? And he started up his backside. And he was so then I went to have him on the table who was I didn't know that before. Right? I was taught that if you don't put your finger in it, you English saying, English saying that if you don't put your finger in it, you make a mistake. You might miss something. Right. So that's why you do the finger thing. Yeah, just part of it. The PSA these days, they want to do it every year. Before we used to do it every year. These days, they think you should do it every other year. But the finger thing is a good thing to do. So, okay, so you were saying his finger is short, so he will reach it. Maybe no, no. I mean, even me, I don't have control. Or even the youngest, the smallest gastroenterologist or anybody, your finger is able to reach the prostate.
I really just have a comment, and I way about James the man girl, but it was a woman or girl. But number one is at age 20, I was diagnosed with COVID. I am 68 years old because I followed the recommendation of my physician, getting the regular check after that. And I just needed more often because number one, it's a little rare being diagnosed that early. And but I am here today because I followed also want to say I actually am a three-time sister, and to listen to my doctor, I am still here. I was initially at 20, a colon cancer survivor at age 40, and at age 60, a stomach. So I'm telling you, if you learn your body, take care of your body, pay attention to it, it will make all the difference in the world. 10 years ago, I lost prostate cancer. He did everything that he should have done. Well, not initially, because he wasn't married to her. And I had to stay on. And I know y'all hard it, but if you love yourself and you love your woman, there's one bit of uncomfort that you have getting that prostate exam. Just love yourself, understand your body, follow the recommendations. If something doesn't feel right, go and get it checked out. I will tell you, you are the team leader with your health care in your body. If you feel uncomfortable about something that the told you, you have a right to a second opinion. Understand that you are the team leader and you need to pay attention to your body. Everything you love to do, take it home and tell it to the child, the good, the other person. They taking themselves and they can as well as you looking after them. I'm gonna try to stay in my I have I just I'm sorry.
You are fine. But hold on, guys. For the sake of time, I got to go ahead. Like I said, your finger test doesn't tell you about cancer. The finger test just tells you that your prostate is enlarged. The blood test tells you about cancer. And having said that, this lady may have something called Lynch syndrome, but this is where this guy comes in. Yes, and can I do his introduction? That's what I'm trying to. I want to make sure I get to all the doctors and okay. So thank you so much, Doctor. Y'all give him a round of applause. Thank you so much. Uh, Next on the panel, we have Dr. Cameron Robinson. Dr. Robinson is a resident physician at the Medicine and Pediatric Program at the University of Tennessee College of Medicine. After completing his residency, Dr. Robinson will pursue training at the hematology and oncology in hematology and oncology. Dr. Robinson will address the importance of the annual checkups for men.
Hey, how everybody doing? And I think we kind of talk about that a lot because when you think about the annual checkup, you think managing our diabetes, managing our blood pressure, but never really talking about screening. And the reason screening is so important because a lot of cancers are actually curable if we're able to catch it early enough. And she brought up a great point about being married and being together. How many in here are married? I thought a great number. How many people in here have a primary care provider? That's it. No, definitely. What I would recommend, and I do it myself because I on the adult side actually see couples. I say take a day off of work, go with your significant other, and do an appointment together. Reason being, for instance, me and my wife we went together, and I didn't know I snored at night, and she could complain to the doctor that I snore at night. Come to find out, I have sleep apnea. But if I didn't have my wife tell him, like, yeah, his breath cut off when he sleep, I never would have known, and she would have woke up to a dead husband. So I'll say definitely go, because one thing about it, you might not tell, but your wife will, and tell it all too. So that's one thing I definitely recommend. And we talked about the physical exam and getting your prostate checked. Very, very, very important. And like we said, having a long finger doesn't necessarily matter, but having a sensitive finger does, because we want to make sure we can feel those grooves, feel those ridges. If something feels uncommon, we know what to do after that. Because the thing about it, being a black man, seeing black men, we usually don't go to the doctor really until we're hurt, and usually that's when it's an issue. I know being an internal medicine doctor before a GI doc, you always hear if you see a farmer coming to the emergency room, shut everything down because they're more likely having a heart attack or it's dire. And that's kind of is with our with us. Like usually having diabetes, doc, my foot hurt, I smell something. You look down, foot is like has gangrene and riding off because of a serious bacterial infection. So what we want to do is have these annual checks, or even like semi-annual checks, just to make sure everything is going okay. I guess to bring it close to home, I wasn't quite 20, but 29, I started noticing change in my bowel habits, started noticing blood in the toilet. I was thinking maybe it's hemorrhoids, whatever. But I was like, this isn't normal for a 29-year-old. And this is right after Chadwick Boseman died of colon cancer. So I remember going and set up an appointment with my GI doc, and I'm explaining to him and everything. And he was like, maybe the ulcer. He's like, basically, it's uncommon to see somebody under 30, really under 25 with these issues. And so after a long conversation, he's like, no what, I'm gonna give you a colonoscopy. It was not that bad. I guarantee you, it's so quick. You go to sleep and you wake up like, what happened? Long story short, he found a polyp the size of a thumb in my colon. And as I said earlier, sent to the pathologist. Fortunately, it was precancerous. But I have to go back. But just imagine if, as we said, we didn't listen to our body. And I want to wait until 30, wait until 40, wait until like 45, 50. It'll be a different diagnosis. So one thing I definitely want to bring up too, I know I spoke to the young lady from WashU. Definitely one thing that needs to happen within our community is when we do these family trees, we also need to put what our family members died from. We really need to know what our family history is. That's very important because after I found out I had a polyp, I asked my mom, I like, yeah, I got a polyp. She's like, yeah, I had one when I was 27. I like, well, I wish I would have known that because what it is, if somebody has a polyp, let's say, for instance, I was 29. My son will have to go, you know, we say every 10 years, you subtract 10 years from when your parent or your sibling found the polyp. So my son will have to go in at 19 or 20 to see if he has polyps, just because I was so young when I had one. So that's important to know what your brother has, your sister. I know it's like a lot of husbands that like, you know, eat, want to play spades and have fun at our barbecues and kickbacks, but we need to be talking about health as well. We could talk about LeBron James, Michael, Kobe, but we need to be talking about, hey, you go to your doctor yet? Did you go get your screening and get your colonoscopy and really bring it up? Because one thing about our culture, we're very familiar. Like we love having fun, we love being with one another. That's just what we do. But also, like in the same breath we say we love each other, we definitely need to make sure we check on each other and making sure we're healthy. And that's just one thing we do is like ask, hey, have you been to the doctor yet? Or for instance, if somebody, I lost 30 pounds and me and my brother, we call each other every week. Hey, did you do this or did you do that? Just like kind of hold like a subtle accountability. You know, we really don't like being accountable right up. Like, did you go to the doctor? We don't feel like we're being blamed, but we definitely have to give each other that nudge. Because my dad always said, I'd rather be seen than viewed. And that's how I want to, and something as simple as going to the doctor once or twice a year can prevent you from being viewed. And so that's my spiel, because like we had great speakers before me, but I'm here to answer any questions about physical exam or screening. And how many of y'all have sons? To give them this message, make sure y'all like they establish a great relationship with a PCP, because y'all are here. And that's great that y'all are here, but y'all understand the importance of health. We either have loved ones, we have friends, colleagues that are going through health troubles, but it's the younger ones, 20 to 40, that think they're kind of invincible still. They just don't understand. My grandma says, keep on living. But we're going to make sure they keep on living, also have a happy and healthy life as well.
Well, I wanted just to say this to you, Dr. Robinson. The awesome thing about being the moderator is I just found me a new primary care physician, right? And an oncologist that I definitely want to get information from. And because of one of the things for me as a male is like I go to Life Signs, I do a physical every year, but I've never really felt comfortable finding my primary care doctor, because you go in, it's like a 5-minute, you okay? You know, you don't really get somebody that my experience is just, it's so quick and so brief. It's like, what are we doing? And so that was the thing. And I told my wife at the beginning of this year that I wanted to find a primary care doctor who looked like me, who I could come in and just be able to talk. And so I'm 47, and I didn't do the full colonoscopy. I did the sample. I did the sample, and hearing what you said lets me know that no, I need to go ahead and go further, because I want to be here. I got a lot of time. I got a lot that I want to do, and I don't want to find out something that I could have prevented just simply because I was fearful. Because I'm looking in this room and we're in a church, and my book said God didn't give me a spirit of fear, but of love, peace, and a sound mind. So anytime I find myself walking in fear, I know that's the enemy keeping me away from what God might have for my life, right? So I just want to thank you so much for that. And I do want to open it up to give an opportunity. Does anybody have a question for Dr. Robinson before I go to our last panelist? Any question?
Well, I do. I don't have a question, but I have a comment about, I know we all take or should take yearly physical, but back when I was 30, I believe it was, I took a yearly physical, and the doctor called me back and said, one side of your heart is larger than the other. And I hung up on her because I said, you got the wrong person. I run 3 miles a day. I work out. And at that particular point, folks, I look like a heat man. So I'm like, I don't think you got the right person. She called back. She said, you need to go to a cardiologist. And I still wasn't convinced that this was something that I needed to do. Because, look, I played football all my life. I exercised all my life. And so we go to the cardiologist, and I'm looking around, and I'm like, a yearly physical was something I did all through college. Not when I was a child, because my family didn't take me, or they couldn't afford to take me. But it ended up, I had a hole in the upper chamber of my heart as big as, they said it was the biggest one they had ever seen. I was losing 90% oxygen in blood, but I didn't know it. I didn't know it. So when we talk about a physical and testing, it is just something we need to do, because that whole ordeal of having my chest split open and having surgery, and I wasn't aware. I wasn't aware anything was going on. I was young. I had my first child, and I think Luke may have been 3 or 4, and it was just a big ordeal. So I say this to say I'm thankful for the information, but if you're not getting a yearly physical and keeping up with all these exams, then we're in trouble, because I would have just dropped dead and didn't know why. Mind you, now I had physicals from a college that was a SEC college. So I never knew anything was wrong with me. I had no symptoms, none of that. So I just wanted to just impart the knowledge that the yearly exams are very important. And I was born with that condition. And the bigger I got, the bigger the hole got. And I knew that, because the language they were talking, I needed to call one of these guys and say, hey, man, what's this language they talking to me? I don't know what you're talking about. This man coming there showing me a picture of my heart, and I'm trying to see where the blood losing that. I'm like, man, I don't see what you see. So no, I ain't finna have no surgery. What's wrong with y'all? And I called back to the doctor's office and said, hey man, I'm changing doctors. I don't need to see you no more. I had a condition that only surgery could heal. And so I just just share that to say we need to take care of ourselves in the way of getting these tests done. And EKG, I knew what it was, but I didn't think it applied to me. Did y'all hear me say I ran 3 to 4 miles a day?
Yeah.
I'm like, y'all the ones that's overweight and got the problem. I ain't got the problem, but I had a problem. And I was grateful for the testing. And I hope that even though we're small in numbers, but that we can just reach out to other people, other brothers, and tell them this is important.
Yeah, absolutely, absolutely. I just, as we said, y'all give him a round of applause. Absolutely. I got a question over here.
Has the process changed as far as when you go to get a physical? I mean, it used to be kind of, I know I used to go get one, you could talk about the knee, your head, your heart, but now it seems like they stick straight to just physical, whatever it's on the chart. Is that the new process, how things work now?
It's kind of hard to say what individual like doctors do, but with me, we talking about everything. We talking about from your head, top of your head to the soles of your feet, what stresses you out, your kids. We talking about everything because it's a relationship. Because how can I give you information and you don't trust me? So one thing I tell all my patients, my job is to use whatever knowledge I have to help you make health decisions. So it's already a partnership. Like I tell everybody, I got a 2-year-old. That's the only person I could tell what to do. Other than that, like it's give and take. It's like Kobe and Shaq, Mike and Sky, like we together. So that's what it should be. You should be able to feel safe. And I take what I do with with a great responsibility because I know some diagnoses of my patients that their family don't even know. And so that center of trust and that room, once I close that door, it's whatever you want to talk about. And along with going over some of your health, well, all your health needs.
Can you explain to me quickly, kidney health, if the kidney is say 45% and you do the right thing, it can increase?
Yes. So what I think we probably talking about is it's like a ratio to kind of see how well is your kidneys like filtering out certain like waste and everything. And certain things can help you as far as like changing your diet, making sure we ain't eating certain foods like red meats or heavy with proteins or sulfur, things of that nature. So there's a lot of things that can actually help improve your kidney function. And the main thing really that's really important is managing your blood pressure. Like managing your blood pressure, they call it hypertension is a silent killer. Like everything, like basically every organ in your body needs blood. If it can't get it, it's gonna be an issue. So that's why people go into heart failure. Heart pumps in all that pressure so long, after a while, it just breaks down. Kidneys. If you can't get certain like blood to your kidneys, guess what's gonna happen? It's gonna try to get more and more blood. It's gonna try to compensate over time. It's gonna get so muscular or so hard to pump against that your kidneys gonna start failing. So the main thing you definitely want to do is like manage blood pressure, and things that help with that is moving, eating better. Like a lot of like I call it a lot of stuff like man-made illnesses, diabetes, hypertension. Like there is some type of genetic predisposition for it, but literally like our lifestyle dictate how it presents, when it presents, and how bad it gets.
One thing to take away from all this is that don't be afraid to ask your doctors questions, right? A lot of times people will go and see the doctor, they finish talking to the doctor, they go outside, then they're asking the nurse, what did he say? Right? The nurse may not even have been listening. The doctors can't do anything to you. Ask them any questions. And I always say, if you ask your doctor a question and they won't answer, change him. Right? Because you have a right to know what is going on with your life. So always ask questions. At the end of my interaction, will always say, do you have any questions? Some doctors don't ask, do you have any questions? But you should say, I have a question. Or doctor, can you explain this? And they have to. If they don't, change them.
That's good. And so, and I just wanted to speak to that too. Sometimes I think we get upset with doctors, but a doctor can't read our mind. And so if we already go in with a I'm fine mindset, and then they don't find something because and they're asking what every time you go to a doctor, I'm pretty sure every time I've ever gone, they ask you what brings you here today. right? And in that moment, that is your opportunity to say, you know what, my Achilles has been killing me for the last 2-3 weeks, or I've been shortness of breath, or I've been feeling a little tightness, right? And so whatever those things are, we have to start or be comfortable in saying those things and giving them an opportunity to speak back to it. But it is unfair to expect somebody to know what's wrong with us without us sharing what's wrong with us. Go ahead. Yes, sir. That's good. Yeah.
I just want to share that I write my questions before I go to the doctor.
Yes.
Because what happens sometimes that you'll leave the doctor's office and you say, man, I forgot to ask him about this. I forgot to ask him about that. So I write my questions down, all of them. And when I pull my questions out, they'll look at me sometimes, but they'll answer my question.
That's awesome. That's awesome. So I think what we take away from what Dr. Robinson is saying, or I'll ask, do we take away the importance of making sure we're doing the screenings, right? Important to get the screenings, do that pre-care before we have to find ourselves needing to be at the doctor for something more serious. I think that is awesome, because when you really think about it, a lot of the diseases that they're talking about, a lot of the things that we experience, we can prevent it. Like, we can prevent it from becoming something that can take our lives if we just take it a little bit more serious. We heard one of the doctors speak to the fact of being active, moving. When you talk about your digestive system, getting up, walking. Some of us might be at a place where we can run, but we can go walking in our neighborhoods. We can take a moment to just get up, to breathe. Sometimes you would be amazed how you help your body function just by taking in good air, oxygen, breathing, things like that. It's important to do those mindful things along the way. So I thank you so much, Dr. Robinson, for sharing. Yes, sir.
Where's your office? So as far as like the adult side, I'm at UT Baptist out on Wolf River in Germantown.
I'm coming.
No, so definitely, if you ask for Dr. Kim, they know what to do.
Oh, I'm hoping you brought a car. You're not leaving without. We're gonna get some formal stuff from you all today.
Oh, yes, sir.
So I definitely appreciate it.
And then and for your kids and teenagers, I'm at Le Bonheur downtown, and I see everybody from newborns all the way up to 18 there. So I see the whole family.
That's awesome. Thank you. So now our final panelist, and then after this panelist, we'll take a 5-minute break. We'll kind of walk. We'll do we're gonna do a door prize. Do two. Okay, I'll do two. We'll take a break after this. But our final panelist for this session is Mr. Henry Isaac. He's a mental health professional. He will share his expertise on why mental health is essential to men and how to maintain a healthy mental well-being. Thank you so much, sir.
Thank you. I am mentally stressed with all this talk of the exams, but I probably need to see a therapist. But I just want to touch bases a little bit about mental health. I am a licensed therapist, and one of the things that I would say to you all is this: if you take care of your physical, you also got to take care of your mental. Okay, so that's very important. So people ask all the time, what is mental health? Let me give you a definition of it. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. You know, for a long time, it was said that when you mention mental health, somebody thought crazy. But that's not really what mental health is. Mental health is our mental well-being and how we handle our environment, how we handle stress. And when we can't handle stress and our environment in a healthy way, then we become mentally ill. And what we want to do is to figure out, why does mental health issues get negated by men? All right. So I came up with the top 4 reasons, and I will give them to you right quickly. Number 1 is the stigma attached to mental health. It causes men to suppress, their emotions. Y'all know, as a man, what we're taught to do is what? You deal with it. You pull your pants up and you deal with it. You don't show emotions. That's what we were taught. That's what we come up with. But that's the stigma centered around it. And the other reason I want to bring out is the suicide rates. Listen to this. According to the American Foundation of Suicide Prevention, men die by suicide at a rate of 3.5% higher than women. All right? You ask, why is that? Women attempt suicide more, but men actually go through it. You know why? Because they use more lethal ways of doing it, guns and other lethal things. So then we look at some of the reasons why our mental health suffers. It's because as men, we don't really tend to our mental health because it's not something that we were taught to do. We were taught to just to get up. You're a man, get up, get up, get up, and let's go. But I want you all to understand how important mental health is, because it is important for us to understand ourselves and we get ourselves in a position to where we can handle the everyday life. Because I'm going to tell y'all this, and just bear with me for a minute. How many of y'all drive in Memphis? Raise your hand. All right, y'all drive in Memphis, right? All right. So if you drive in Memphis, I can legally diagnose you with PTSD, anxiety, and some more stuff. Okay? So we can legally do that today. But the thing about it is our environment that's around us. And our mental health is so important to us being able to control what is going on around us in a healthy way. And men, we don't talk about emotions. We don't talk about feelings because we couldn't. I remember when I'm telling y'all about that experience I had. It was a real health scare to me, but I bottled it up. I bottled it up. It was like I could hear my grandfather telling me, "Hey man, you're a man. Don't you sit down and cry." But when this man came into that, I saw him huddling in the hall, and they came into my room. And the man said, "You got to have surgery." I cried like a baby. I'm like, "Man, what you mean I got to have surgery?" But my mental was at the time something that I just had to take it. And I want all of y'all to know that your mental health is very important, just like your physical and just like your spiritual. We also got to add mental health into that. So I would suggest this. If you are having any difficulties, and even if you're not, that you find a therapist that you can trust, that you feel comfortable with, and be able to go to that therapist at least once a year, if nothing else. At least once a year, if nothing else. So I just want you all to understand that mental health is important in all we do. And because think about this, what do you do that's not mental? Think about that. What do you do that's not mental? I mean, it's like, because I'm glad our pastor don't preach but 25 minutes, because if I had to sit down for 35, 40 minutes, I'm in trouble. We look at depression, and some of us are depressed and don't know it. We're depressed and we don't know it. And so I say this to you all: the depression, the anxiety, those are things that we experience on a daily basis. But if we don't get help for it, it tends to take us in the wrong direction. So I like to talk mental health. I could talk for the next hour or so about mental health, but Smith, I didn't say nothing to you, but okay. But I want y'all to understand the importance of mental health and how it is important for us to tend to not only mental, physical, and spiritual. Very important. So I thank y'all sitting up here with these doctors. I really feel special today. Thank you. But any questions you have, I will try to answer them. But do not negate mental health, because it does not mean the stereotypical I'm crazy. Society today. Nobody has problem-solving skills. Do y'all understand that? No, the problem-solving skills just go away. And then we picking up guns, we picking up the things that we don't need to. But for our mental health, please, whatever you do, tend to your mental just like your physical and your spiritual. Thank you.
Excellent. Any questions? Any questions? Any questions?
There's a big stigma about going to see a mental health worker because you think somebody might say you're crazy, right? So what I have found helpful is that you usually start by talking to your pastor, right? I mean, your pastor will usually listen to anything you have to say, even if it's your wife bugging you at home, he'll listen, because sometimes just talking to somebody about it, right? Somebody will give you a different perspective in a way you haven't looked at it. So even if it's another man friend that you have, you can talk to that person, right? He might say, oh, I know this mental health worker you can go and talk to, or when this happened to me some time ago, this. So you unburden yourself instead of it being working. So always find somebody you can talk to, somebody you usually respect in your society or in your community is usually a helpful person to talk to.
That's excellent. Thank you. Thank you. I just want to add to that statement. I believe that in being transparent. So in 2017, I had gone through a transition in my employment to work for myself. I'm a former Memphis police officer, and everything was going well. And I got out there and I was excited, and things didn't go the way that I thought they were supposed to go. So every day, my family and my wife would get up and go to work, and I'm fine. But really, I wasn't fine. And I was depressed every day, and I was sitting and I was isolating myself at home because it was things that I felt like I was supposed to be doing, and it wasn't happening the way I wanted it to happen. And I found myself in depression. And it got so bad that in 2017, one morning I was up, I was trying to pray, but I was just like, what do you do when you're so depressed and people tell you to pray and you're saying, I'm angry at God because I'm trying to do what you asked me to do, and what's going on, right? Why is this happening? And so this morning I tried to get up and I tried to pray, and the enemy was in my ear, and he just said, you should just kill yourself. You're a failure. Look at you. Nothing you said was going to happen. It's not happening. And literally, I'm sitting there, and I'm crying because I'm so sad. And I could just muster up enough to wake up my wife and say, he's trying to get me to kill myself. And so what we're saying in this process is, I know it to be so true that we walk around and we say that we're fine when we're really not. And we're trying to live a life and we don't know who we can talk to. And it's important to find somebody that you can say, this is overwhelming me. We have to get to a place as men where we can find somebody to say, I'm overwhelmed and I need somebody to talk to. It does not make you weak to go and seek out a professional that can help you sort things out. Me and my wife talked, and through my job, I was able to go and do 10 sessions with a licensed counselor who could help me navigate through some of the things I was dealing with. And I'm here today, right? And I'm moving forward today. And so what I found out and what I realized is, and I'll be done, is that these things happen in stages. Like when you're 20 years old, you think you're invincible. By the time you get 40, you start to realize, wait a minute, this shoulder hurting a little bit more, right? And you start to realize maybe I'm not as invincible. But then when you get to 60 and 70, then the thoughts, I believe in being very real, is like time. And you start thinking about life, and you start thinking about the things that you thought that you were going to do, or the things that you hoped to accomplish. And maybe I didn't get to where I wanted to be. And what I'm saying to you all is, even as you get older, it's okay to say, man, I'm not okay, right? I'm not okay. And I think what I would love to see is men being more open and honest to say, I'm not okay. And I need somebody, I need some help. And when we do that, we can find the help that we need, because then we have to turn around and then tell our children, our sons. We don't want them to think that you just got to suck it up, and because that's not what life is about. It's about when you need help, seek help. And when you get the help that you need, move forward, and then make sure that you tell other people it's okay to get it. So I encourage you guys to do the things that you need to do for your own mental health, so that you can move forward, and then you can help those young people that are coming behind us. I think every person in this room that raised their hand and said they had children, Those children need to know. My children know that I struggle with a bout of depression. The reason I did that is because I want them to know that it's okay. That can be a moment, but you don't have to fall into a depression that could cause you to hurt yourself. And so what hurts the Black community more than anything is our secrets. The things that we think, oh, I'm just not going to say anything. I'm just going to hold it to myself. And when we do that, we really hurt another generation of people because they think that they have to live in those same secrets. And so I just encourage us all to really take that serious.
And I'm gonna add to that. Like, remember we saw the family tree? That goes on the family tree as well. And also, definitely want to add, if I was to tell y'all, I want you to go to Sweetie Pies in St. Louis, and then you have to go on the road, what would be the first thing you do?
Gotta find out where it's at.
Exactly. And what would you do?
I'm a GPS.
Exactly. So that's what a therapist is there for. Like, you've never been to Sweetie Pies, you don't know where to go. You might know, like, I need to go up 55 to get to St. Louis, but how to actually get there and navigate, that's what our therapists are great for. Like, we don't know how to unpack depression, we don't know how to unpack anxiety, but they know how to get you to there and how to help you navigate it through in your life. Because everybody has their own road, their own map in life. And what a therapist is great for is like they have that roadmap to help you navigate through and how to deal with it. Because just because we handle this issue now doesn't mean it won't come back up later on in a different form. But having that expertise there will help you navigate through there. And you brought up a good point about like passing on trauma to the next generation and everything. And fortunately, my grandfather stopped with him because I remember being like a little boy and I'd be upset and I'm crying and everything. He'll allow me to display my emotion. He never told me not to feel where he's like, you're human. But after that, what are we going to do about it? And like have a plan and think, like, he's a military man, he was a major in the Army. Yeah. And so my son, he's 2. I'm like, all right, Cam, he's crying, and I'm letting him have a moment. Like, he's human. I'm letting him feel that. All right, Cam, I'm speaking life to him while he's going through that. All right, Cam, now what we want to do? He was like, well, like, Daddy, I want to do this. I'm like, well, that's what we're going to do. But like his toy broke, or I'll say he fell off the swing or whatever. And like, I'll teach him it's okay to feel, but we're going to get back up and we're going to try it again a different way. But you're here, but express to me why you're going through that. And sometimes you don't feel safe enough to do it as a family. That's what we got therapists for. That's why we like going to the barbershop, because we like talking and letting loose. I tell my barber, you got the hardest job in the world because you got to be an artist and you got to be a therapist.
That's right. That's right.
But that's what like these institutions are there for. It's simply because like we didn't have access to it back in the day. But now that we do, we need to utilize and take advantage of it.
I see you come up. You got a statement, young man.
What's going on, y'all?
Nothing
I'm
much.
his son, so I can give you for real evidence to what he was saying is true. He still got the scar on his chest, but he was lying a little bit. He didn't immediately turn his life around. He was still ignoring the doctor. He was trying to work out like 3 weeks after the surgery. But the question I have for y'all, when you were speaking about finding a PCP and then you talking about finding a therapist, a lot of times as Black people, we've been done so wrong in the healthcare and the mental health field, whether it's as you're a kid, people are trying to put you on medicine for things that you can control yourself and learn how to control just to sedate you. And then when you talk about being an adult, we've seen things like our wives, mothers, not be able to get the same epidurals that a white woman would get because they're deemed tougher, harder, just because they're Black. So when you're looking for, primary health or PCPs, what is y'all's advice for getting in with a solid Black person that's going to take care of you, understand not only your rights, but just the elements that you go through as a Black person? Thank you.
Well,
Great question, by the way. Great question.
That's an excellent question. But the thing I want to say is, unfortunately, there are not enough Black doctors. Right now, what some of us are doing is we are going down to the high schools, presenting ourselves, making them see that, look, if I can do it, you can do it, right? Mentoring some of them, encouraging them to study the sciences, and hopefully we'll get more Black people into the profession, because there are about 13% in the States, Black people, but the only 5% of doctors that are Black. So we all can't see Black doctors as much as we want to. If you can, it's a good thing. You can always Google people. You can always find out how to, and these days when you Google people can see a picture, You can see what they look like, and you can decide you want to try to see them if it's possible. But if you can't get a black person, go and see a green person, a blue person,
yes,
anybody,
yes.
rather than not see anybody at all. Right. But I mean, like I said, I came to Memphis because it's nice to see my patients look like me, right? But there are not many of us, right? So it doesn't mean that if there are not some of us, don't see anybody. See whoever you can see. If there's a black person you want to see them, right? But don't say because this person doesn't look like me, I'm not going to go. Other than that, you miss out.
That's correct. And you know, it's a real thing with African Americans entrusting a system. Let's just put that on the table. That's real. Tuskegee and all of those are examples. But I think overall we have to be aware of getting somebody that we can relate to, no matter what color they are, who they
Yes,
are,
yes.
but as long as we can relate to them and they can relate to us. Because when I went to therapy for the first time, I didn't know I had childhood PTSD. I didn't know what PTSD was, as a matter of fact. And until I got to college, and I had to address issues that I didn't see, but a professor pointed it out to me. And so I had to go to a white therapist because that was all that was in the area that I lived in. And so I do understand Luke's question, and it's just a matter of finding somebody that we can connect to. It's just finding somebody we can connect to, whether they blue, green, or whatever they are. But it is a problem that African Americans, males, need to get together and just talk about a system that has not been very kind to us. That's a real thing.
That's good. Reverend Baker has a statement.
And
we're gonna wrap it up.
I do want to just say a couple of things. First thing is, church is therapeutic, but it's not a therapist.
Amen.
All right. There's a difference between coming to worship and experience a therapeutic experience than going sitting down talking to a therapist. Because I understand that when somebody comes to talk to me, you probably ain't gonna talk to me but 2-3 times before I'm gonna point you to a professional. Because I know my limitations and what I can and can't do. The next thing is cultural competence is real. It's absolutely real. I was in my latter 20s, starting working on my master's, and because of all the reading, my eyesight just started doing crazy stuff. So I grabbed the list of ophthalmologists I could go see, and this one was close, and I went to see him. He was out here in East Memphis, so went to see him. He had a nice office, and I looked around, and there was 2 or 3 more black people in there. I'm like, okay. So he run tests on me, and well, I don't see nothing. I'm gonna send you over to get a CT scan, and got a scan of my head, and he's like, well, I don't see nothing. The only thing I see is your orbital rim is thick. Your optic nerve is thick. It looks like glaucoma. So that's the only thing I can see. I'm gonna prescribe you these drops for glaucoma. So he diagnosed me with glaucoma, gave me some drops. I used the drops 2 or 3 times and threw them away because they burned my eyes. So years later, I go insurance change and I go to another doctor. And I sit down and he says, on here it says you have glaucoma. And I said, yeah. He said, who told you that? I said, well, the last eye doctor I went to diagnosed me with glaucoma. He looked at my eyes, he said, you don't have glaucoma. As a matter of fact, there's nothing wrong with your eyes. He says, and I'm gonna prove it to you. So he had these tests that he ran, And he came back and he said, look, people, now both of these were white doctors. They both were. He said, people who don't see a lot of black people don't realize that black people's optic nerve is thicker than white people. Just by you being black. And he said, if the doctor you saw, and he asked me, how many black patients did that doctor have? I said, I don't have no idea. He said, well, let me tell you something. He said, I practiced on the south side of Chicago for years. All my patients were black. All of them had an optic nerve that looked like yours. That's how I know there's nothing wrong with you, because I treat black people. And I never thought about that. But cultural competence is real. Now, I'm not saying that that you should seek out all black doctors, because having worked in the hospital for years, I know some horrible black doctors out there. Absolutely, they out there. And you know, you don't need to just go to them because they black, but go to them because they're competent. And the next thing is, it helps if they are culturally competent.
Thank you so much. Thank you so much. So guys, due to time, first of all great information that was given. So yeah, we want to give everybody a round of applause for that information. We want to now take. I think we're good. No questions at this time, is it? Good. Okay, so I'm ready. Cedric Carter. Mr. Carter, here you go.
And then it's Mr. Harold Mann here. Harold Moore, I'm sorry.
Mr. Harold Moore.
He's in the kitchen, okay.
All right.
And come on, grab for your prize from Mr. Harold Moore.
I'll give you a choice. If you want this, or who wants this second umbrella. So you got a choice of which one you want. And then whichever one you don't choose, you can give it to Mr. Moore. How about that?
Real quick, we are going to take just a quick 5-minute break, but before we do, if everybody comes to the front, we need to get a group picture real quick. If the speakers will come around in front of the table, Pastor Baker, you were standing next to Angela to hold this sign. We need to, y'all, we working on problems. Y'all know we got time to get the pictures and go down. So let's get this picture, because I know for lunchtime, y'all are not gonna have time for me.
Yeah.
So we'll do the picture real.
Thank you all so much for coming up for the picture.
Pastor Baker, you need us to go up there. What do you think? I just need to get the picture.
Wherever you tell us.
Okay, let's get up on the stage. Let's get everybody up there. That way I know we get everybody. Ms. Carl, you got that phone? Okay. And you all have for, we didn't have 5 phones. We're gonna use one phone to the one person. Wait, but do all that. Come on, Ms. Burke. Is everybody in the audience? If it's too hard for him to get up there. Yeah. Now, if that's too hard for you to come up there, we can do another picture down here with you. That's one to be comfortable. Can you get him on the phone? Nothing's gonna be able to okay, well, let's get him. Y'all crunch in, act like y'all like each other. Yeah, tighten up a little bit. We don't wanna move the podium. Can you get around the podium? Yeah, we can pull this chair. He go right around, can you reach up at the podium? Because we sit him in the chair. You think you sit him right there in this chair? Can you get him in that picture? Oh, right in front of that speaker? Okay, we get him in front of that speaker.
Try to shift this way.
We're gonna do what he said. Because I'm not a photographer.
You come here.
We following him.
Tell him where he is.
He's a technical, but tell him where to go. You can stand right there in front of that pole, in front of that speaker. Is it okay if you stand right in front of that black speaker? Okay. All right, y'all good. Thank y'all so much for being, helping me get this picture. Council, somebody said something, let's go, got this take picture. Pass the poster down, just look, one, take a couple with the poster down on this end, and yeah, and then we're gonna go the other way. Pass it down. Okay. All right, you all will hold it in front of you all. Thank you. Does everybody got pictures? Good. All right, we're gonna take a quick, that's one. Thank you. We're gonna take a quick 5-minute break so we can bring up the next set of speakers. And then, we're gonna transition to the fellowship hall for lunch. Thank you all so much. Yeah, we can. That way it's. Mr. Allen, you can set this right in front of the podium. Just lean it against it so we can have it in all the pictures. That's gonna help us out. Thank you. Please visit the vendors while we're doing the 5-minute break. They do have resources for you. So please take one. Take one. If I say in black. All the vendors outside, and they got T-shirts at the Shelby County.
Yeah, good. Good to see you. Yes, sir. Yes, sir. Enjoyed your presentation. Uh-huh.
I'm just talking these exams, Chuck, I might need prayer.
Oh, yeah, absolutely. Yeah. Yes, indeed.
Okay, we're good for lunch. 5-minute break. We're right back in. Survey. Oh, when they come back in.
Sure.
Good morning, how you doing? I want to get a picture with y'all in front of the, somebody hold the sign. It's okay, I want to get one more picture of the, all the docs and the ambulance. Okay, that's great. All right, we'll make sure y'all get copies of this way. Uh-huh, yeah. I enjoyed your presentation, this item, man, it's a lot, but I said, I know this by God, being here. They have, and I work a lot with the people at West Clinic and, Evan Blazer, the reason I'm here now is because of the surgery that he did, I mean, he was fractured. Yeah, well, he knows my body well, didn't take the body, and I work a lot with, Dr. Gregory Fidel, out the way. That's really, a lot of them, in fact, we presented in the, San Antonio Bristol, event together, in December. Yeah. Thank you, I enjoyed you. Yeah.
Yes, sir. All right, so, you let your kids get back. Hey, before you go to the pool. You have a card. I wouldn't want my kids to, you give all my practice back to them, and I think give the card back. Okay, all right, that'll work. Okay, no question. What's the studying in Washington?
I'm master's in social work.
Okay.
Well, no, you have to say that.
He just told me that, he told me the name. No, he was taking a picture, but I'm gonna get it.
And I'm looking at that, he looks at me.
Okay, no worries.
We're trying to get our men involved. And I want to get a group on the way. I'm working, I'm actually working with. That way all the problems.
And you're the one to get it out, because we got 7 minutes back. We're gonna get everybody.
I'll come.
Y'all We gotta get back started.
Great St. Thomas is on our leadership. Down in Whitehaven, Joseph G. Yeah. You're not in the South, is you? You're all okay. No, that's another city. Yeah.
Where's Mr. Dow? Let's see here. Cedric Carter, okay. Okay, so we'll just write him in, and we'll let him close out. We'll let him be the last one because we want to leave on a positive note. So Cedric Carter, okay, we'll put him right up there, and I'll take Joseph. And I have one outside. Can everybody, good afternoon. If everyone could come back in, we're getting ready to get back started. Because we do want to try to have everyone in the fellowship hall no later than 12:10 because the program does end at 12:30. So we're a little behind schedule, but we're having good conversations and we thank you for your time today. The last door prize that I have is going to go to, let's see here. And if you're wondering how we're doing the door prizes, we're going by how you register. So when you register, it gives us a date, time when you register. And so the last door prize that I have is going to go to Mr. Cornell Dye. Is Mr. Dye here? Well, let's give him a hand. Here you go, Mr. Dye. Thank you so much. And we're going to do the gift cards when we do lunch. So that's why you got to stay to lunch. So now that everybody's back, we're going to turn it back over to Miangelo.
Thank you guys so much. Hold on one second. Mr. Carter, is Mr. Carter in the room right now? If you, will you be able to come up? You on the panel, you on the big floor. Somebody gonna take your place up there? So as we continue today, first of all, I just want to thank everybody for coming back in. How did y'all feel about that first session? Give me a round of applause if you like that. Very informative, all right? So now we want to talk about health. We're going to have a discussion around healthy living. And our first panelist is Officer Landon Guyton. Officer Guyton is assigned to the Austin Peay Precinct in the Fraser Raleigh area. He's been with the Memphis Police Department 6 years. He was born and raised in Memphis. Officer Guyton is a proud father of a beautiful, talented, amazing, and intelligent 9-year-old daughter. Currently, he is assigned to the Group Violence Intervention Program. And today he will share information about men and gun violence in our city and discuss the importance of gun safety. So everybody do me a favor and give Mr. Guyton or Officer Guyton a warm welcome.
All right, how y'all doing? Good morning, good afternoon. Like you said, I am Officer Guyton. I have been on 6 years with the department, and currently I work with a program called the Group Violence Intervention Program. Before that, I'm still at Austin Peay Precinct. That is the Fraser and Raleigh area. That is the same area that I grew up in. I left Memphis in 2000 and went to college in Nashville, Tennessee State University. So I know this part, like me and Miangelo's making jokes, this is gonna get the most questions or the most opinions, and that's perfectly fine with everything that's going on within the city as far as violence, especially gun violence. We are seeing that a lot of the perpetrators of violence are younger, from ages 12 to all the way to 50 to 60 year old be. And I know that is alarming, but the educational part of talking about gun violence is known to make sure that we all are safe, right? A lot of that does not get relayed over to the public. the mental part, all of it ties together, like things that I see with the PTSD and the mental part. A lot of times we are sensitive to the mothers in the house when their son or their daughter, their loved one is a victim of violence, but we also got to look at the whole totality as a whole. The other day we had an event at a church, Grace Baptist, where we had a call in, had 24 men. There was 24 men, wasn't no women in there. They're on probation, and their crimes are all the way from murder, attempted murder, carjacking, theft, everything. We're just talking, they're trying to give a message of hope. The person that you were, society or what people say that who you are, that doesn't go to who you are. So we're trying to change the perception of things that we have going on in the city. And after the program was over, several of them said we didn't never think that the police were here to help us. We just thought y'all were here to harm us, stop our fun, and not try to, basically to lock us up. But we're just trying to let people know that there's a different side of it. Yes, I am. Before anything, I'm a son. I have a mom, a dad, of course. Then I'm a dad. That's the thing that I'm most proud of. And yes, I am a police officer. So the thing that I try to get across to people is that even these young men in the city is that I'm just like you. I just had to make a choice to turn my life in a certain direction. So with the program that I work for, that's what we're trying to do within the city. Now, yes, the crime it's out of hand, and that's the nicest way that I think I can put it. The things that we have going on within the city, but the police officers in the city, we also need help on putting a stop to. We cannot be everywhere at one time. That's very, very important. We'll go to a house, and like I called y'all 30 minutes ago, and that is a very sensitive thing, even to us. We do care, but we had to deal with something else. That doesn't mean that your call was not important to us. So I'm here to answer any questions you guys may have about things that's going on in the city. I can't answer all of the questions, but I will try my best ability to help whatever you guys have to ask, what we're doing as far as the police department with this violence in the city.
I love it. Thank you so much. Appreciate you, Officer Guy. So now, any questions around what we have going on when we talk about the guns, gun violence, where we're going? Any questions in regards to that from the audience? Go ahead.
As others, but what's being done to address the crazy driving? I know gun violence is happening all around us, but the driving, this drag racing, and I mean, you drive down the street and just folks driving in the wrong lane and just flying, and I don't know what can be done about it, but I would, how does the police department look at that? Is that at the top of anybody's list, or where is that?
No, it's most definitely the top of everyone's list. To speak on that, this summer, or even starting, it's June right now, so it's still considered spring, we call them details. And what that means is there's a certain group or division of the police department is assigned to go wherever that's happening at and try to put an end to it. I know it made the news, and of course I read the reports. I think approximately maybe 5 or 6 arrests was done this past weekend, catching that guy. Of course, when we pull up to the scene, they're gonna take off. They're not gonna just stick around and just they're gonna make us do our job. This past weekend, they did start doing details to stop that. It is frustrating in my line of work to see it, and then they just keep doing it, but we do have things in place that I can't fully just enclose that we're doing. It is being very monitored, but we did make several arrests this past weekend with those drag races. And anytime the sun comes out, they already organized. They already had the places they're gonna go, but we are watching it very, very close. So that's what we're doing right now for that.
And I just want to take a moment to speak to it. When we talk about the way that people are driving in the city, you know that a lot of it stems from 2020 when everybody went home. And so when everybody went home, people were able to drive however they wanted to drive because everybody was at home. And so people were racing to get around the city. And of course, that wasn't the most pressing issue at the time. Well, what happened is when everybody comes back outside, as we say, we got back outside, people continued to drive the way that they were driving when most people were not on the expressway or most people were not on the road. And then it just became a thing that became overwhelming. Well, you got a police department that is 400 officers short, and you got the crime, and you're trying to deal with the crime, and then so now you're over here addressing the crime, but now they're on the interstates driving crazy and reckless. And so it's just at a place where it takes us as citizens, citizens used to call in tag numbers when they saw certain things, or, and so it takes people being in a position to help. And that's what we're talking about as far as with our police department. They cannot do it all on their own. And I do know that in certain communities, people are fearful of calling the police, or people are fearful of saying something because you don't want the retaliation of if this person finds out that I said something, right? But at some point in the community, we're going to have to stand up, and it's going to take the citizens, the taxpayers, the people that are going to work every day to be louder than the voices of those who are screaming and saying that, the police are not doing this, or at some point we're going to have to stand up and say, we back our police department. This is not a political moment. This is not me trying to turn it into that, but it's really at a place now where you see where we are when we allow those that maybe not have the best interests at heart of our larger community. Those voices are being heard the loudest. So our police are being stifled in a way that they're trying to do a job with their hands tied behind their back. So we have to come to a point. Go ahead, sir.
I'm from Detroit. I live down here.
Yes, sir.
Now, Mr. Clinton was in office.
Yes, sir.
Detroit was having the same problem we had in Memphis.
Yeah.
The crime of guns. And so what Chief Police did, they on the phone, they called Washington. They called Ms. Clinton.
Yeah.
For help. You know what Ms. Clinton did? He sent Detroit $1 billion to fight crime. So why don't CJ, head the police department, get together with the mayor and call Washington and call Mr. Biden. He's a Catholic, like Mr. Kennedy. I'm sure he'll send some money, some funds to him to fight crime. I'm certain.
So because I don't work for the police department anymore, I'm gonna answer that question.
Okay.
I'm gonna not put that on him to answer that. Well, you have to understand the time frame of when that happened. During the time when Mr. Clinton was in office, there was this push for being tough on crime. Well, what came out of that time of Mr. Clinton being tough on crime was when they had the concept of the super predators, but that also was not the right answer because there were so many African American males who were incarcerated for things that maybe they didn't have to spend as much time in prison for. So now you fast forward to 2024, right? And you have people who are in these political offices, and you have all of this criminal justice reform that they want to see happen. And so it's a different time to where law enforcement is not viewed in the same way as it was then.
I realize that because I support Alliance Police Share PAC. I've been constantly sending money each month to them. If I can do it, I can see why the President of the United States can be contributory to them also, and which you all are there. You remember Travis, he's active. I mean, I can see why the bank can be contributory. They just call the police department by helping with funds to hire incentive to hire new officers in like per se the high school, coming out of high school, instead of going to college in the unions, join the Army, join the Navy, join the Air Force, join the police.
And also another thing too is also you have good officers and you have people that are leaving the field of law enforcement.
I understand.
Because they don't feel, it's just the same as teachers, right? People don't feel appreciated, and who wants to go to work with the thought of being indicted for doing your job?
And you got these young people coming out of high school, they understand criminals.
Yeah.
Because they're the same age. You understand these people. And they can go take up criminology, go right up to Fort Campbell, Kentucky, and get trained by military police officers, and come back out with $2,000 of them, maybe $2,000 a month, $2 2 weeks, it can be done.
Yeah.
I just call Washington, comes back. He's Catholic, Mr. Kennedy. I'm sure you're passionate with Memphis and not Memphis.
Yeah.
That's all I have to say.
I love it. I love it.
Thank you.
A lot of that comes from education, right? I deal with gangs and groups.
Okay, yeah.
All right. So I played basketball with some friends one day,
All right.
and I think that Mike Brown had just occurred. And that's around the time that I said yes to doing this job. I filled out this application probably 6 times to be a police officer. And finally the recruiter was like, why do you keep telling us no? Like, I don't like y'all. I don't like how y'all do stuff. I don't like this, I don't like that. So he was like, well, you can stand outside and you can say all the stuff you don't like, or you can come in here and you can try to change it. So that's when I said yes to the job. I asked my friend, he's a part of a group, we're the same age, I'm 42 years old. So I asked him, how is it that you can recruit young dudes to join a gang, but you can't recruit them to be a police department? If they look like us and they understand us and they come from the same streets that we come from, the things change. Yeah, money is very important in this. Money is very, very, very important in what I do.
Thank you, sir. We appreciate it. Thank you.
And money is very important in what we do, but you're gonna have to care about people to do this job. Like, I have to care about you to show up at your house. I have to care about you to talk to your son or your daughter, or even talk to your mom. More than money, you got to be worried about how I treat you. If I just get paid and I don't really care about what I do, then we have more instances that this department may be on the news for the wrong thing. So yeah, money is very important in what I do. My daughter has a $100 Amazon cart right now that I gotta clear by next week, but I have to worry about like her future. It was cliche when I was growing up. My mom would tell me that you are the future, you know what I'm saying, of America, your future of the world. Now that was cliche to me. Now I understand what that statement really meant. So we have to, my age group has to transfer that over to these juveniles. No, they're not scared of me. I talk to them every day. They're not scared of me at all. They'll look at you, roll your eyes, they'll do whatever, but we have to, as a community, and just being quite frank, we are the leaders, like even black men, we are the leaders of this city. Even every skin tone, we have to look out for each other. No, and I understand, like I go into apartment complexes, go into neighborhoods. I have people tell me all the time, you just work here, I got to live here. When you get done with your shift, they're still gonna be here with me. So it's a big circle of responsibility that goes around in it, but the political aspect of it, I'm not gonna speak on that part. Like that's not me. That's why I appreciate him. But no, we have to. It's a more of a caring factor, and like I can complain all day, but we do need help to combat everything that's going on in the city.
That's good. That's good. Go ahead. Go ahead.
Yeah, back to what Pastor said about crazy violence. I saw the dude made about 5, 6 arrests. Now, I think I heard CJ say that they will start taking the cars for a period of time. Is that happening now when they so how long period is it? 7 days or 2 days?
It's a legal process they have to go through. I work in the room with investigators, and a young man called. He was mad they can't get his car back. All right, they have to do a whole investigation into what you're doing. So that's some things that I just can't like speak on to just knowledgeably like fully answer. But no, we will hold your car.
I'm coming to you next. Yes, sir.
That's good. First is just calling. Whatever precinct you live in, they have a community outreach person in that precinct. we will talk to you. She or he will sit down and talk to you. You got to talk to the colonel of their precinct. But a lot of times there may be 10 houses on the block. It's just that one house that's causing all the disturbance. We need to know because they may be ducked off. Even if they're not ducked off, it's just the communication part that comes into us knowing like what's going on. That would help for one. Two, more of these meetings, the city council meetings. A lot of those meetings have fingers pointed, but at a certain person or a certain group, meaning us or Chief Davis or anything like that. But just letting them know what's going on, what we can pinpoint. Every idea that you give, what you say, don't think that she's not taking it serious. Like she's taking it in and she's doing the best that she can with all of us. I think she said yesterday, it may be close to 2,000 of us. So she has to filter all that in and come up with strategies and all that. So to help us with the crime, we need to know what area and what's going on. If you call in and you just don't want, if you want to be anonymous, hey, tell the call taker, I do not want to speak to them. Then we can just go from there. We know how to take reports and launch investigations and things like that. But the communication part is the best way to help us with the crime.
Can I add that? And I'm coming to you next. Well, two, I got you and then you. Also, a lot of times in your communities, everything is not a police matter. But if I'm in my neighborhood and I notice that this person has moved in and they got multiple cars and they got cars in the grass, that's code enforcement. You can make a phone call to code. You don't have to tell them who you are. And so sometimes you can go about dealing with situations without having to necessarily put yourself in the middle of it. But it's important for communities to come together. Like, let's start there. Your community, you need to know the people in your neighborhood, if possible. But you also need to know the resources that are available to you. So a lot of times the things that you see before it's a criminal act, it's a code violation. So then somebody needs to be able to know, how do we reach out to code enforcement? How do we get them to come out and check these things out? They don't have to know why they're out there, but you can put pressure on criminals to say, this is not a good neighborhood for me to do my crime in because these people are watching out and they're taking care of each other. And no one has to be vocal and say, I'm the one that called the police or I'm the one that called code enforcement. You just need to know what's available, the options that are available for you to be able to do it. I think in Whitehaven, someone called because it was a mechanic shop, but in this mechanic shop, the work that they were doing was always late at night. It ended up being a chop shop. Somebody called in because it's like, okay, I understand this is a shop, but what mechanic shop do you know that's open every night from 10 to 4 in the morning? So if somebody's making that call, then that alerts somebody that this is, so then first code enforcement came out. Once code enforcement came out, then they did their job and then they got the police department involved and the father and son was arrested. So what I'm saying to you is oftentimes if we look at codes, then we can get to the other things that we need to get to. Yes, sir.
I think that's the part, like I said, it falls on the educational part of informing the community what's going on. So, and just to be honest with you, these young boys, they know what's going to happen to them. Exactly.
These look, like he said, these, I call them Thundercats. These young Thundercats. Because this is what they think. Even if you come, I'm gonna take off. So just because you make it here, don't mean you're gonna catch me. And then because I enjoy the chase. Like you think about it, a lot of them enjoy the thrill of doing donuts, waiting for the police to come, because you know that the police have a policy on pursuit. So I know that they can't chase me if it's not a violent felon. So they know that they can take off. And so then, and now the police, this is the problem, is that the police get behind them for that and they chase them and somebody has an accident. The thing that is always baffled me is, why do we hold the police accountable for that and not the criminal that created the environment to create the chase. But now we're at a place where we're saying, well, why are the police chasing them? So now we've created something where the criminals know they can't chase us. So we have to be very careful when we say we want things to be put in place, because now we're living in some of the decisions that we put in place many years ago. So we have to be careful with that. You had a question?
Yeah, I want the officer to speak to the fact that the governor had allocated some money for us to receive more assistant state troopers to assist you all in traffic. Will we see more of their visibility? You can speak to that now that it's getting more. I saw some of them last year that were here. He had already assigned so many who came to town. Then, of course, you always need more. You know that. You help you all do what you do. But will there be more of them this summer? And now they'll be coming in to Shelby County.
Okay, I'm gonna add, I know you asked him that question, but I can tell you where they are. They in Hickory Hills. They're in our community every weekend. They're doing traffic stops. They are, I'm not answering for him, but I'm just gonna answer part of the question. They're patrolling the Wolf Chase Galleria Mall, because they go out there and do racing and wheelies out there. So I don't know about all the communities, but I can tell you where a bunch of them are. Come over there on Winchester. Come to Hickory Hill. You come over there between Winchester, especially Riverdale. That 385 loop, they're wearing us out over there. They're there they start Thursday night and they're till Sunday night. Literally every other weekend. And they bad tags, they pulling you over bag tags. They're pulling you over if your music too loud. I mean, they're saturating Hickory Hill. Now, I don't know if they're going to any other part of Memphis, but I know they're in the Hickory Hill area.
Yeah, she's very right. It's strategic placing. I say that. Okay.
So it's not the same place. If it's not the same place every time, they try to kind of hit hot spots where they see the crime, where they see the things going on. And I'll say this to you because I used to, of course, being a police officer. The reason sometimes I step in is I don't want him to put himself in a position that there's something that he might not need to speak to. So that's why I ask. I'm not trying to kind of take in for him, but when you're in a role, you got to stay within the role. You got to be careful of the things that you try to speak to. So I just want to kind of speak to that. Last one, and then we're going to keep the panel. Or I'm sorry, here first, and then you, and then that'll be it.
I just want to say this, I was real active with the police department, but there are things that you can do. There is neighborhood watch association.
Yes.
If you do not have a neighborhood watch in your community, you need to do that. As a church, whether you know it or not, if you have a neighborhood watch, it will reduce your insurance premium on your church. The other thing that's going on, there is a camera connection program that the Memphis Police Department has, where they will ask you to share your various videos and stuff with them. And many times, that evidence is how they're able to catch criminals, because I know in my area, I live in a Peabody Vance area, we've got all kinds of people that are sharing their camera information with the police, and they take that and build on that. You're still not putting yourself out there. And when you get to know your police department, it makes all the difference in the world. I got everybody on speed dial. I got everybody. It makes a difference. And you're not going to put yourself out there. They just want to know what you can do to help. And you can clean out a lot of mess in your neighborhood if you listen and talk to certain people, and they're not exposing you. It's neighborhood watch, and they have a new program for business and homes. If you've got ring cameras and all this kind of security systems, they can use that as part of their investigation to build on. They still won't put you in the middle, but you can help them catch a lot of those criminals.
That is excellent. That is excellent information. Yes, ma'am. You have one.
I'll piggyback on what she just said, because with all the sky cameras I see here, but when you go to court, I got a big nigga that everybody that is about my age, it's like they're not afraid to arrest me.
Yeah.
They're afraid to arrest me. I'm down there, I'm doing a 5 mile load here, I'm sitting in court like, everybody looking like me, there's something wrong here. So what's the difference? I mean, are they afraid to arrest?
No, you stopped. No, you stopped. That's it. You stopped. Like you, because you are, no, you're a law-abiding citizen. What I'm saying is they're running. They're running, right? That's like a lot of times when the police stop them, they're taking off. The police can't chase them because if something happens, he's going to be held liable when the criminal, and I'm not going to say the criminal, when the speeder, because I want to make sure we use it right. If you're a speeder and you drive off, that is not a felony. That is not violent. That does not hurt anybody's life. So he has, by rule, he has ordinances that he has to follow, or then he can find himself being charged for violating policy on chases. So that's what I'm saying is like they're trying to do a job with their hands tied behind their back. And the citizens are looking at them and saying, well, why don't you chase? It's like they have a policy around not being able to chase a stolen car. This is something that the city council voted for many years ago, right? And that sounds good because people get hurt when officers chase. That's the thought. That sounds good until you walk outside of the gas station and somebody took off in your car and the police officer standing there and he says, what's your name? Let me take the report. And you're like, wait a minute, the report, he just left in the car. Go get my car. But by policy, he can't do that. So again, we have to be mindful of the things that we allow our council to put in place because it sounds good, but what does that do for our community? And what does that do for how we police our community and make it a safer community? And I think sometimes we don't really look at that, right? So what I want to do for the sake of time, though, is if there are any other questions around policing, gun violence, or any other statement around that before I go to the next part of this discussion. All right. So next we have Miss Katrina Kimball. She is a community educator and I'm just going off of this. I know you're not a community educator with Alzheimer's. Let me do it like this. Miss Katrina Kimball, and I'll leave it at that.
Thank you. So I was not supposed to be here. The person that's supposed to be sitting in the seat is Mr. Zelda Hill, and I am not Zelda Hill. Unfortunately, he had a conflict and couldn't be here. But I thought his part was important, so I wanted to just share a few things real quickly with you. And again, I want to thank the officer for being here. I'm involved with Men's Health Network, but this is not my job. I work for the Alzheimer's Association. But men's health is important to me because, one, I have a father. I lost my father very early in my life. And then two, I have two sons, and I have two grandsons. So men's health is so important to me. And I go wherever Mia Angelou goes. So usually if y'all see us, we tag team together. And I just want to speak about two things real quickly before we turn up to the most important person, which is he's going to share his survivor story, is that when it comes to Alzheimer's, one of the things is it is a fatal disease, but there are some things that you can do to keep your brain healthy. Just want to share a couple statistics with you. Right now in the United States, there are 55 million people diagnosed with this disease. Okay? This disease is more prominent in the African American community and the Latino community. But it goes back to what the panel of doctors were saying earlier. A lot of times we don't have a relationship with our doctor. A lot of us will go to work every day and have money taken out of our paychecks, and we never use our benefits. Do y'all think about that? Do you realize that you're going to work every day and they're taking money out of your paycheck that you're never going to see again, and you don't utilize your benefits? So use your benefits. Like they said earlier, build a relationship with your doctor. Also, a lot of us that work, we have access to EAP, the Employee Assistance Program. You can get up to 7, depends on your company, 7 to 10 free counseling sessions. We got this thing in the Black community about what happens in our house does what? Stay in our house. Okay, it's so we need to stop letting it stay in the house. The whispers are killing us. We talk real loud about the foolish stuff. We talk about the Kardashians and all the games and who playing and this. Some people are not studying you. They're not thinking about you. You spending all your time looking and watching those people, and you're not living your own life. And I just want to encourage us, since we're talking about healthy living, the only way you're going to know if you're living healthy is you got to stop and do an assessment. Now, I know, because I'm in here with men, so I know this answer. How many of y'all take your cars, make sure your cars are running good? You get the oil change, check the belts, you do all that. Now, how many of y'all have been to the doctor this year? Y'all getting better. because you all will take care of that car, that truck, and you'll be falling apart. I know because I have two sons. I have a son right now. I tell me Angela all the time. I said that toe he gonna get up one morning. That toe gonna stay in the bed. And he gonna get up. He injured his foot 2 months ago, and he's 36 years old, and he has a job with insurance. I do this every day. I said, how can I go out in the community and talk to people? Everybody listen to me but you, and I'm your mama. He has not gone to the podiatrist. I told his girlfriend, prepare yourself. Because you're going to get up one morning and you're going to hear him screaming like he lost his mind. And that toe going to be still in the bed. And he going to be getting up. And she just looked at me. I said, don't call me. Because I don't care. I won't hear about it. Because I've been telling him for 2 months to go to the doctor. Utilize your EAP services. Go to the doctor, as I've already told you. But also, I want to share that June is also Alzheimer's and Brain Health Month. So I'm going to give you a couple of things you can do to keep your brain healthy, because I think a lot of time we think that we're so focused on this physical part out here, we don't do the work for this part up here. I say all the time, we got to do the hard work, and the hard work. The hard stuff is what's just in your head, it's what you're feeding your brain, right? So how many of y'all know whatever starts up here, everything starts with what? A thought, right? So who would have thought years ago that we'd be able to take pictures and videos and see movies on our phone, right? Never thought about that, but it had to come from where? It came from the brain. It had to start with a thought. So I want you all to write this number down. You ain't got to write it down, but it's out on the table. If you know anyone that's dealing with Alzheimer's or dementia, call 1-800-272-3900. Again, that number is 1-800-272-3900. We have some brochures out on the table. You need help if you're caring for someone who has Alzheimer's and dementia. This is a fatal disease. There is no cure. I have walked this journey with Alzheimer's 3 times. My grandmother had it. Unfortunately, my mother got diagnosed in 2015. But she's still alive, y'all. She's 92 years old. Now, I will say this disease has robbed her of who she is. So when I spend time with her, I tell people her job is not to remember me. My job is to remind her who she is. I will admit that my mom has now end-stage Alzheimer's. She can't walk. She can't feed herself. So we had to make the difficult decision to put her in a facility. Now, I know a lot of people say, I ain't putting my loved one in a facility. Well, I'm here to tell you, there is nothing wrong with placement, because there's going to come a season when there's a time for placement. My mom can't feed herself. She can't dress herself. She needs help. So we made the decision to put her in a facility, but we go there every day. And I think when we make the mistake is thinking that, I got to put my loved one here and then I leave them. No, you go back and you stay with them. I mean, I'll be on calls with them and I'll be there at the facility. I'm like, look, y'all, I got to go see what the nurse said, because I'm trying to make sure her last years on this earth is her best years. And a lot of times within our families, don't lose your family over caring for a loved one. Do what you can do and leave the rest over there. Why you fighting and running your blood pressure up? They was crazy before you got them involved. So why you trying to fight with them down? Let them stay over there. A lot of this ain't have nothing to do with COVID. Folks, you talking about COVID. Y'all, some of these people, some of this was happening in these behaviors before COVID. So stop acting like you surprised. Let them be who they are, but don't lose your peace of mind over it. Okay? I don't care who it is. I don't care if it's a job. I don't care if it's a person. Everything is about relationships. And then the last couple of things I'm going to share real quickly, because I want to make sure he has time to share. There's some things you can do to keep your brain healthy. First of all, challenge your brain. Do some puzzles. Listen to music. We in the church, learn the books of the Bible. How many folks have been in church all your life still don't know the books of the Bible? That'll challenge your brain. Learn them in order. Because some folks like, you ain't got to go out here and take Spanish. If you want to take Spanish, you can, but do something that challenges your brain. Do something different. Drive home a different way. Don't go home the same way all the time. Because when you challenge your brain, it makes it builds new synapses. Your brain is like, oh, wait a minute, we're doing something new. I got to figure out what we're doing. Come take some kind of class. Whether you come in and participate in your church Bible study, or if you take something out of the community college, find something that you're interested in, keep your brain going. Do some kind of movement. Now, I ain't telling nobody to join no club and exercise because Katrina ain't doing that. I don't got time. I work full time. I take care of my mama full time. I get enough laps at the nursing home. But do something. If you have a yard, go outside, work in your yard. If you clean in your house, vacuuming, cleaning, do some type of movement. Make sure you protect your head. For younger people and for those of you that ride motorcycles, I can't tell y'all how many people when I was driving up yesterday. So my mom lives in Panola County, so down in Mississippi. I was driving up I-55. I cannot tell you how many people flew past me on motorcycles and none of them had on helmets. And I mean, they were blowing past me like 80, 90 some miles an hour. Protect your brain. We already talked about not smoking, but this is my pet peeve right here. Stop sharing your medication. Well, she take 8 milligrams and I only take 5. Well, I'm gonna break the pill in half. No, stop doing that. And I say this everywhere I go, we keep seeing so many adults coming in the emergency room from, we call it mismanagement of medication. Take your medication like you're supposed to take your medication. Don't share your medication with someone else. They don't have your DNA and your genetics. You don't know what you're doing when you're giving somebody, especially pain medication. Don't do that, okay? Talk to your doctor. If you need help getting your medicine, there is an organization called Patient Advocacy Foundation. They can help you get your medicine. And then the last thing I'm gonna share, and before I stop talking, is we gotta go to bed, y'all. Stop staying up all night. One of the things you can do to fight all these diseases, and the doctors told y'all all the other stuff about managing your medicine, eating right, moving. Go to bed. How many of you have gone to bed and then woke up tired? You know what that is? There's a difference between resting and sleeping. We don't know how to rest in the Black community. We don't know how to disconnect. We feel like we got to always be doing something. We got to always be moving. I'm not doing nothing else when I leave here. Matter of fact, I'm turning my phone off when I get in the car. I have a gift called the gift of goodbye. I will not answer my phone. I will turn my phone off because nobody is doing the race I'm running. It takes a lot out of me to be a full-time caregiver and work full-time and then come out and support my community partners and doing things like this. I'm not complaining. I'm not looking for an award. What I'm saying is I know myself, like Mr. Isaac said, I know mentally what it takes out of me. So I'm going to make sure the rest of the day, I'm not pouring out anymore today because I don't have nothing left when I leave here. And that's your greatest gift you can give yourself, men. And I'm saying this because I have brothers that, I don't know, it's a switch in the back of y'all head. Y'all can't turn that switch off. Y'all won't stop moving. You won't stop moving. You get off work. My brother got off work. He had just came out of town from preaching a 2-week revival, changed his clothes, got the truck, and got the lawnmower. I said, what are you doing? Well, the grass got to be cut. The grass gonna be there tomorrow. I said, is the grass gonna get up off the ground and run off somewhere? No. But my grass, I said, who looking at your yard? Is there a grass police somewhere? Do you get a fine if you don't cut your grass? No. I said, go in the house. Your wife in there. Go lay down.
Katrina, I did the same thing, came off a vacation.
And I fussed at him the whole time, and he told me that. Stop moving so much. And stop saying, well, my significant other, my wife, tell her no. You ain't got to move. I'm going to tell you the greatest gift my dad gave my mom. He would get in his truck, and we would go ride around Sardis Lake. He wouldn't even say nothing. We'd just be in the truck riding around. You know why he did that? Because he needed a time for himself. He needed a moment of quietness because my dad was a pastor. My dad pastored 48 years. He had been married 54 years before he died, and he had 10 children. So it was always somebody calling and wanting something from me. I'm just going to say this one more time. Men, please rest. We need our fathers. We need our daddies. We need our uncles. You are so much more to us than your paycheck. Because I promise you, if I could have an hour with my father, I would. So if you don't listen to nothing else, please get you some rest. And for the women in the audience, encourage the men in your life to get some rest. Encourage them to live well and take good care of themselves. And thank y'all for letting me make these few comments.
Thank you so much. Katrina, thank you so much for just sharing the wisdom around Alzheimer's and things that we can do to be better. And finally, our final panelist is Mr. Cedric Carter, and he is going to be speaking to you all and sharing his survivor story. Brother, we thank you so much for sharing, and we appreciate you being here today. Y'all give him a round of applause, please.
Thank you. It's amazing that you just got through talking about resting. I've actually been off work for 8 days, and normally when I'm off, I tend to log in. Not this time. Not this time. I just enjoyed these 8 days. So I'll be back there good and fresh Monday. But my story starts. I was 32 when I was actually going to a doctor. But if most of the guys that are around my age, I will actually be 60 this year. When we were young, our parents took us to the doctor, and we got physicals. Did we not? And I think I stopped for a minute in my 20s, started back in my 30s, 32. I went into the doctor because I was having problems urinating, and the doctor just said, he said, you have an enlarged prostate. And it was so amazing that you said between the large and the small fingers. I had never heard that before. I had never heard that before, but when it first happened, I'm like, what do you got to do? But one thing that he did not do is taking the blood. It's not about that finger, it's about that blood. Everything's in the blood. So everything was fine. My first son was born when I was 38, and I started taking my regular physicals. Everything was fine, 38, 39, 40. He said, your prostate, your PSA is actually going up. He says, nothing to be concerned about right now. He said, but next year, we're going to take a look. That next year, I was about to be 41. He said, we need to see what's going on. Sent me to Conrad Pearson Clinic. My doctor was Dr. H.L. McSwain. Didn't realize who H.L. McSwain was until Pastor talked about him. Pastor, anyway, I'll get to that part. But we went in, and the biopsy, whew, I thought it was going to hurt. And I've heard that they have really changed how they do biopsies now. But my biopsy, they actually poke your prostate 12 times with a needle. And it didn't hurt. It just felt like pressure because of how they were doing it then. But results came back. 3 of the pokes were cancerous. 3 of the pokes were about to be cancerous, and 6 were normal. And he said, and I think someone said it earlier, he said, if you need to get a second opinion, get a second opinion. He said, but thanks be to my Heavenly Father, we caught it in time. That was my second opinion right there. So he asked me and my wife at the time, are you all done having children? We had just had Jasmine. She was 4 months old. And I said, pretty much, we're done. So he said, well, best thing that you probably would need to do is just go ahead and get it out. Got it out. That pain medicine that you talked about in the hospital, he came out and he told my wife, he said, you have a soldier in there. He was ready. He was ready for surgery. And I still don't know what he meant by that, but I think normally it takes 4 hours for that surgery, and they did mine in 2. So that night, I called a nurse. I said, I need to get up from here. I gotta walk around. I gotta get out this bed. Walked down the hallway, came back. She said, I'm gonna help you back in the bed. I'm like, I'm not getting back in that bed.
I'm not getting back in that bed. But I end up later on getting back into bed. But you know, as you know, you actually have a catheter, and that they gave me this. They said you have pain, press this button. I thought the button was to call them. It was was they get the medicine. The problem with me with that was I accidentally pressed it one day while I had company in the room and fell asleep right there. Before I went to sleep, my kids and everybody was there. When I woke up, my friend was there. So, and I kept talking. I was saying, "Stop, CJ," before, and it came out after. I'm like, no, this is not what I need in my system. This is not what I need. But I had surgery on the Friday. Was in there Saturday. The doctor came in my room Sunday. He said, "Are you ready to go home?" I said, "Why? Did my insurance stop paying?" So he said, "No." He said, "You haven't pressed your pain medicine since yesterday." I said, "I'm not in any pain." And I didn't like the way it was making me feel anyway. So now the one part where I needed that medicine was when they pulled that drain plug out. When the doctor tell you it's gonna hurt a little bit. He said, take a deep breath. I forgot what a deep breath was when he pulled it out. And I think I woke up the fourth floor. But I was off from work for 6 weeks, and I was going back every 3 months at first to check it out, and everything was fine. 3 months turned into 6 months. 6 months turned into a year. But in that fourth year, he said, "Okay, your PSA is starting to go back up." It was 0.004. It was really low, but it was moving up. I ended up getting 33 treatments of radiation. I was told, which I didn't experience it, but when you're doing radiation, you can't be in the sun. You're gonna get tired. I think I just started contracting at FedEx, and I didn't miss a day of work because my manager had actually gone through the same thing. And every day after my treatments, it was like from 8:30 to 9:30 every day. I would go in and go back to work. One day I called my mom and I said, "I feel like going to the track." I mean, I just felt energy. I felt like I had some energy to let go. But and all that said, everything was fine. Everything has been fine. I'm coming up on 17 years of being cancer free. So to God be the glory. My son and daughter went to a funeral one day. I think they were like 6 and 2, and we went and viewed the body, and we walked out. And CJ looked at me. He said, "Daddy, what did he die from?" I said, "He died from cancer." He said, "But Daddy, you had cancer." I said, "Absolutely." I said, "God has allowed me a little bit more time with y'all." So that being said, God gets the glory. I have actually, God does things for a reason. I have actually networked with some guys that were actually diagnosed with prostate cancer, and I basically I said, "Hey, it's not gonna be easy. It's not gonna be easy." So, but they actually are. Everybody's doing well right now. So he knew what was about to happen. Pastor, on the day that I had surgery, I walked in and I looked to my right, I did a double take. I said, "What you doing here?" At that time, Pastor worked at Methodist, but he worked at Methodist Central, and this was at Methodist Germantown. But he walked me back, and he told me about Dr. McSwain and asked me who did I know who he was. I'm like, yeah, he's a character. But Dr. Dr. McSwain is the doctor surgeons. So I said, wow, I got the best pastor, I got the best doctor, I got the best God, most of all. But it wasn't easy. It wasn't easy. I actually went through a lot, but God is good. God is good. God is good. So, guys, um, get to the doctor. Get to the doctor. Get to the doctor.
Y'all, please give him a round of applause one more time. Thank you so much. And what I want to do really quickly, because of the time, I just want to say thank you all so much. I'm about to give it to Katrina to give us our closing, but thank you so much for your time. And thank you so much, Pastor, for opening up your church to allow us to be here. For all of the partners that came, we thank you so much for your hard work and dedication to this process. And for those that are just here to hear the information, we appreciate you greatly. With that being said, Katrina, it's in your hands.
Okay. Well, we are at the close of our program today. Again, thank you all for coming out. I'm going to go ahead and give you a call to action. So when we finish eating lunch, we can all just leave the church. Take this information, share it with someone you know. Save the date. Men's Health Month is June. We'll be doing this again on June 1st of 2025. We're not sure of the location, but we would love for your support. And with that being said, I'm going to turn it over to Pastor Baker so he can bless the food, and we're going to go and have lunch. So wait a minute, I see a hand.
I'm Brother Don. Praise the Lord, saints. To Pastor Baker, all of our ministers and friends. I'm Brother Don Baskin. I'm one of the deacons here at Divine Faith Church. My wife and I, we are the relationship ministry leaders here at Divine Faith Church. On this month, we've been married 52 years. Would you give the Lord a hand clap of praise? And we want to share information on better relationships. When you go to the gym, you go to the gym to get better health. We have these sessions to have information on better relationships. We appreciate support, but we really want you to come here to have these sessions to develop better relationship. We meet here every fourth Saturday from 11 to 1 p.m. Everybody's invited. Tell your friends, neighbors, co-workers. Everyone's invited for these sessions on the fourth Saturday of every month. Our next session will be June the 22nd from 11 to 1 p.m. Thank you. This is one of the books we use, 5 Love Languages. You might have heard of that. It's a great book. We have speakers, Dr. Tony Evans and other speakers. So tell everybody you're welcomed on the fourth Saturday of every month. Thank you.
And just as a reminder, if you have not done your survey, please make sure you turn in your survey. And don't forget, we have a $200, $100, and a $50 gift card. We're going to do these drawings over in the lunch area. So we're going to transition and go over to the fellowship hall after Reverend Baker blesses the food. Again, thank y'all for letting us come and be a part of y'all day today.
Let's pray. Gracious, loving God, we thank you for this day, and we thank you, God, for what you've done in our midst. We thank you, God, for all that you have given us, God. We pray that the information would be prosperous to us and that we'd be prosperous in the kingdom. Thank you for the food. Thank you for those prepared. It nourishes mind, body, and spirit in Christ's name. Amen.
seeing you, sir. Thank you so much. Thank you. Not just from here. Where you from?
Thank you so much.
83 by family members and friends, but you just look familiar. But all of us, I appreciate it. Thank you.
We got plenty of lunches, so we're gonna do the 7 people, so y'all can take some lunch on for tomorrow.
Thank y'all, y'all. Make sure y'all come over here. Try to get this change. I know $200 don't go where it used to go. Yeah, it goes from
we're trying to change this. It is hard. Like, in, we're not talking about let people help you.
Really?
But it's getting better now. They're starting to come around. Because a lot of women now, they're like, oh, no, I'm like, well, what do you think you got? But, you have to, and what I think is I don't regret it. I'm looking at that.
You don't get me beat up now.
Hey, just make sure you say my name loud.
Got a cousin that's on sheriff's department. Yes, Kendra. Yes.
Them gentlemen said, they waiting on you.
They waiting on me.
They waiting on you.
No, they waiting on me.
Hold on, what's her name?
I'm on my way.
He said, listen, he said, you tell her. I got down. Don't let them, she just told y'all she ain't gonna let
I'm not leaving. I'm coming back there in just a few minutes. I'm getting everybody time enough to get their box lunch. And there's plenty back there, so y'all can take some home. We ordered 70 box lunch.
And make sure all the kids, before they leave the building, make them pay them back.
Okay.
Make them pay them. No, I'm talking to Deacon.
Oh, no, I'm not picking up our stuff.
Oh, no, yeah, I know y'all covered. I'm talking about my church folks.
Oh, yeah, no, we're gonna leave now, one thing I did promise Reverend Baker, I said, now, we're gonna be respectful. We're gonna take care of the space, get in here and get out, because y'all do have church tomorrow. Give me the stick and grab these here.
That's all.
Yeah, but I've been knowing Reverend Baker for a long time. He knew my dad. Grady McKinney was my dad. My dad was a pastor, so I've been knowing him all my life. He used to come down and do the kitchen. And, we worked together at Methodist. I worked at Methodist with him for a while, doing stuff like this. I used to be over there doing the engagement program. But then, as always, they don't put it in the budget when funding gets cut. We get cut. I'm still doing this work, still doing it this. I'm gonna come back and get the rest of this now.